So good evening, everyone, and welcome to the third session of our four-part New Dentist Survival Guide series, Setting Yourself Up for Success. I'm Dr. Kevin Henner, president of the New York State Dental Association, and I'm so proud of this organization, its members, and the things that we achieve, just like this series in tonight's program. Briefly, if you told me 32 years ago I would be the president of one of the most influential dental associations in the country, I would have initially chuckled and then added, why would I do that? Well, if I could give you an analogy, the New York State Dental Association and organized dentistry is the foundation that will allow you to build the strongest dental home that will protect you throughout your entire career. Get involved, stay involved. It's your future, and you should be in the driver's seat navigating your professional path. Tonight, I have the pleasure of introducing a dynamic superstar, and more so, a friend I've known since the beginning of his career, Dr. Chris Salierno. Dr. Salierno is going to share some insights and tips on how to conduct careful research before deciding the next step in your professional career journey. This includes weighing the advantages and challenges to ensure the best fit for setting yourself up for success. Just a brief housekeeping item. At the end, there will be a 3-question series that you'll have to answer to obtain credit. Dr. Salierno lectures nationally and internationally on clinical dentistry, practice management, and leadership development. He was a practice owner of Broad Hollow Dentistry for over 10 years, chief editor of Dental Economics, and in 2017, he became a chief development officer with the Salierno Consulting Group. Now, Dr. Salierno is the first ever chief dental officer at Tend. Since its successful launch in October of 2019, Tend has rapidly grown to over 250 team members across 7 locations throughout New York City, serving close to 25,000 members. Dr. Salierno is a perfect example of somebody who used the foundation of organized dentistry and involvement to ensure the path to a successful career. Ladies and gentlemen, it's my pleasure to introduce my friend, Dr. Chris Salierno. Thank you, Chris.
Thank you very much, Kevin, for that very kind introduction. I'm going to share my screen here. We've got a brief, fast-paced presentation for the next 45 minutes or so. Then we're going to open it up for questions. So if you have questions as this comes up, hold on to them. We're going to be able to get to them as we get to the end of the presentation. And let me share my screen here. Excellent. Okay. You know, I've been fortunate to do a few different things in my dental career. I am not even right now a regularly practicing dentist, which is interesting. I was chief editor of Dental Economics, as you heard. I was working part-time. I started my own practice. I was very involved in organized dentistry. There's a whole bunch of things I've been able to do, and that interest in non-traditional career paths for me started back in dental school when I got very involved in ASDA. And my goal is tonight to give some insights as to when you know to take that next step in your career path, even if it is a step that may be off the traditional career path. But before we get to that, and that will end our presentation with that material, I think what's really important is that we understand the rules of the game. The dental economic landscape has changed significantly over the past 10, 20 years, heck, even the past 5 years. And there's a lot of myths that go around about this, and those myths can unduly influence your decisions about when to take the next step and what step you should take. And I'd like to debunk some of these myths. I'd also like to give you some data to support what are some of the interesting trends that are happening with our profession, these macroeconomic trends. You should know about them because I think it's going to ultimately help you determine when to take these next steps in your career path. So I'll start very, I'll start at the beginning. I'll start in 2001 when I was a freshman in dental school, and I went to Stony Brook, and you have your orientation, right? You have the folks that say to the brand new dental class as you're meeting each other, they say, hey, the cafeteria is over there, and your lockers are over there, orientation stuff. And the dean, I remember, sat us down and gave an address, as deans are good at doing. And the dean said, this is 2001, oh, you guys are going to dental school at the greatest time in history. When you graduate in the far off year of 2005, oh, it's just going to be the greatest time ever to be a practicing dentist and business owner. Here's why. And he gave us 3 reasons. Here's why. 1, the cosmetic and implant boom is alive and well. We have all these new services we're offering patients, and they're just giving us money to do all this great stuff. Cosmetic dentistry, whitening, veneers, implants, it's just incredible. Number 2, we closed a bunch of dental schools in the 80s and 90s, so there's fewer of you coming out to meet this huge demand. And number 3, the baby boomers will be retiring soon. There's so many of them. They're just going to be giving their practices away. So for those reasons, when you graduate in 2005, it'll be the greatest time ever to be a practicing dentist and business owner. So none of those things came true. I appreciated my dean doing a great job of looking at the economic information that was present at the time, which I'm going to share with you. But then things started to change very quickly thereafter. It underscores the importance of being very keen on looking at these economic factors, but also, getting real data on these economic factors and not just listening to gossip and to myths. You see, when I go around the country and I talk to dentists and I ask them, paint a picture for me. Is it the greatest time ever to be a practicing dentist and a business owner right now? What kind of a picture do you think they paint for me? Is it like a Bob Ross, happy little trees, everything's great? No. They paint a picture that looks more like this, right? This is a great visual metaphor. We have the little cottage industry, and it's about to be wiped off the face of the earth by, whatever the boogeyman is, student debt and DSOs and PPOs are out of control and, whatever. You should have been practicing 20 years ago. That's when you should have been practicing. Everything was great then. Now it's dismal. I hear that sometimes. It breaks my heart, really, because I actually am quite optimistic about the future outlook of dentistry. But what I'll tell you is that the game has changed, and this will absolutely affect your career paths, whether you are an associate dentist wondering, should I buy this practice that I'm currently in? Should I buy a different one? Should I start my own? I think I have dreams of owning several practices. All of these possibilities are before you. And we'll get to the specific decision points that I think you need to really consider before you take that step. But let's also talk about the rules of the game and how they've changed. Let's look at that bigger economic landscape. So first, we're going to talk about macroeconomics. We'll spend some time on that. What are the big sweeping changes affecting the profession and how it influences your decision on what to do next? We'll then talk about a patient-centric business model, because whatever plan you take, whatever step you take, it should have a very specific business plan in place. And finally, I'll give you just some quick decision points. My years with New Dentist Committee and talking to lots of dentists and coaching them on what to do next. I'll just kind of summarize the key elements I think about some of the major decision points. All right, let's do this. Let's go. We're going to talk real fast, but you guys are from New York, so you guys can keep up. This is one of the most important pieces of economic research that has come out. This came out a few years ago. I am going to be sharing with you a lot of material that comes from Marko Vujicic, chief economist of the ADA. He's with the Health Policy Institute. This is, I think, essential reading. please go to ada.org and go to the Health Policy Institute and just keep abreast of all of this really interesting information that will influence your practice wherever you are in your journey. Even if you're a seasoned pro and riding off into the sunset, you're still going to want to make use of this great information. Okay, so here is a wonderful summary of some of the changes that happened over the past 20-ish years. We see on the left the green, the good times. Demand for our dental services, that's the red line there, demand as measured by US working age adults spending money was increasing, and it was increasing by about 4% year over year. Now, my dental dean was right. He was talking to me in 2001. As you can see, this green line ends around 2002 or so. People were giving us more money year over year. They're like, whitening in an office, that's a thing now? Take my money. Veneers are a thing. Take my money. I don't have to wear dentures. Implants are a thing. Take my money. Oh, it was great. Notice the blue line. This is the supply of dentists, basically flat. And we had closed a few dental schools in the 80s and the 90s. And so, yeah, overall, like supply of dentists was relatively constant. So if the demand for something goes up and the supply of it stays about the same, yeah, it's good to be in that business, isn't it? And so we see this green line, dentist average net income, doing all right, going up. Now, let's go into the yellow phase. Somewhere around 2002, things changed. Here's what changed. The supply of dentists was still relatively flat, but the demand for our care started to change. It's still increasing-ish, but it's increasing by about 2% per year. What else increases by 2% per year like clockwork? Yes, the cost of doing business, inflation, although as we know in the past year or so, it's been way higher than that. More on that one. And so we see dentist average net income just do some funky things. Dentist average net income doesn't exactly follow the supply and demand curves, but they're heavily influenced for sure. And then in 2008, I think we all recall what happened in 2008 during the Great Recession. A couple of really interesting things changed. The demand for our care started to flatline. It started to go flat, barely increasing at all. Notice this chart goes to 2012. I'll show you updated numbers in just a sec. But another really interesting thing started to happen around 2008, perhaps coincidentally. The supply of dentists started to go up. There's a lot of new dental schools that have been opening up, as I think you're aware. And so, yes, dental schools perhaps closed back in the day, in the 80s and the 90s, but they started to reopen again. So let's explore demand for a minute. This is an updated curve. It goes back to 2000 all the way up to 2020 numbers. And so you can see from 2002 or so up to 2008, it's increasing, but it's about 2%. 2008 starts to flatline. Interestingly, around 2014 or 15 or so, we started to get an increase again, which was really nice. It's about 2%, so we're not setting the world on fire here. But the demand for our care, has been increasing. We did see it take a dip in 2020. I think we all know why that might be. What I would like to point out, however, according to the ADA research, the increase in dental spending that we have seen over the past 4 years has been driven largely by two groups. Children, thanks in part to public insurance, right? So Medicaid reimbursement rates for pediatric patients has been pretty good, and we've seen some increases in the past few years. And the other group that has driven this increase in spend, seniors. And to be clear, wealthy seniors, not economically disparaged seniors. Seniors that have been able to save up and now have plenty of disposable income into their retirement. Working age adults, though, demand is still relatively flat, unfortunately. That's an important thing to know. ADA asked, hey, why aren't you spending money on dentistry, people? And the people said, because it costs too much. Number one, with a bullet, could not afford cost. Now, we can have a whole interesting discussion about the value of care and perceptions of whether or not they can actually afford that care, right? We should have those discussions. But the fact of the matter is, when asked, they said, I can't afford it. Interesting, look at number two. insurance didn't cover procedures. I would say that's kind of in the same bucket there. Number 3, didn't want to spend the money. Okay, so we see the top 3 reasons, and the number 1 is really big, but the top 3 reasons are all related to cost. So couldn't find a dentist, access to care issues. It was too far to find the dentist, the hours, distant, 4th, 5th, 6th place. Now here's some interesting information from the Federal Reserve. Every year they put out a fascinating a bit of economic research, and you'll find this really applicable to wherever you are in your careers. If you're a new dentist, an associate, you don't own a practice yet, you'll still get something out of this one. Really interesting indicator of the health and well-being of the U.S. economy is they ask, as they do very robust surveys, what percentage of U.S. adults would struggle to cover a $400 emergency? If a $400 car part broke, or a $400 unanticipated medical bill, or whatever were to pop up, what percentage of U.S. adults would have to put this on a card that they may not be able to pay off for a while, or borrow money from a loved one, like struggle to make that payment? The number was 35%. And it's been hovering around that number, by the way, for the past several years. It's been as high as 40%. 35%, that's a lot. So think about this. You have your own private fee for a crown. Let's say it's $1,600. That's great, right? Well, you're in contract with a PPO, whichever one. Let's say the negotiated contract rate is $800 and they cover 50% of that. Patient's obligation is $400. There's your $400. Imagine that if 35%, a third of your patients would struggle for that $400 co-insurance payment. Cost is a real factor right now, aside from value, but we'll talk about value right now. This is one of my least favorite patients that I ever treated. Bless her heart, she just was a bit tough. And she's, as you can see from this photo, I don't even need to do a formal case presentation or show you radiographs. She's going to lose those mandibular incisors for, obvious reasons. And so sent her over to the periodontist. Teeth came out, implants replaced in the lateral incisor sites. We're going to do an implant bridge for her. Oh, what an amazing technological revolution. It's wonderful that we can provide this service to our patients, right? Oh, so nice. Keep them out of a partial denture. Amazing, right? It's great. We get hugs, we get high fives from our patients when we're able to do that. Well, this wasn't one of those patients. She sits down in my chair after a few months of healing. She's wearing her provisional restoration. She's got healing abutments. She's coming in to just, take impressions and finish this case up. She sits down in my chair and she says, "Well, how long is this going to take before I get my teeth?" Like that. And I say, "Well, I got to take impressions. I got to send it to the lab. And then, they try something again. And then it's about a month." And she cuts me off. She says, "A month? That's ridiculous. There's a guy on the radio that says he does teeth in an hour. So what's taking you so long?" So what I wanted to say to this patient was, "I'm sorry, but I'm replacing a body part. That should take some time. By the way, I'm also replacing a body part that you lost through criminal negligence, right? Like, you ashed your cigarette on top of your tartar for decades, and you're annoyed that it takes me a month to replace that for you?" What is this phenomenon that we have noticed collectively as a dental profession over the past bunch of years? This, you hear it called like a sense of entitlement, that dentistry should just be free and be done yesterday, right? What is this? There's another term, and the AGD was the first to coin it that I'm aware of, the commoditization of our care. That our healthcare service gets treated as just this commodity. That's important. That's an important economic factor that is affecting the demand for our care. Our service becomes a commodity. And so the reaction that our patients have to us is not that dissimilar from in the past when I've gone into a Jiffy Lube. Now, I normally like to go into my mom and pop mechanic. That's what I do now. But way back in the day, I didn't know any better. I went into a Jiffy Lube because it's, in a Jiffy, it's fast. It's not expensive. It says it's going to be $30 or whatever for an oil change. So I drive on in and they say, yes, it's only $29.99 for an oil change. Great. Okay. I sit in the waiting room. And what happens after a few minutes? The mechanic comes back in and he says, well, good news. We're running a special today. Instead of the regular oil cleaning, oil change for $29.99, we can give you the deluxe synthetic super goober awesome unicorn tier oil change. And that's only $59.99. It's normally $89.99. And I'm like, oh my God, bait and switch, upselling. No, I don't want any of that. Just give me the crappy oil change. I don't care. Leave me alone. And then defeated, the mechanic goes back into the shop until he comes back in a few minutes later holding the air filter. Yes, this is very good salesmanship. He says, oh, I just happened to notice while I was there. Look at this. You're breathing this. It's gunky. It's nasty. Of course, it's absolutely filthy. And I say, no, put it back in there. I'll breathe it. Don't stop upselling me stuff. I don't care. There's no trust here, right? I feel like that mechanic just like grabbed some shop dust and threw it on there before they came in. No trust, upselling, bait and switch. Blah. We're all fatigued by services that have become commoditized. And my friends, I am telling you this anecdote, and those who have been to a Jiffy Lube are like, oh my God, yes, that exactly the same thing happened to me. I'm telling you this anecdote because this is sometimes how our patients respond to us when we tell them, I know you came in for a cleaning and that's what your insurance company talks about, but like you also need an exam and you need a full mouth series of radiographs. And like, no, just the cleaning. That's where that comes from. We're all tired of just clicking yes on terms of services updates that no one reads. And we're tired of hidden fees and nonsense. It's everywhere. A lot of things are becoming commoditized. And it really burns me. Oh, it burns me deep that a healthcare service could be treated the same way as an oil change. But that's what it is. And we can get busy living or get busy dying, as they say. We can either adapt to this change or we can just complain about it and let it overwhelm us. All right, let's move on to supply. So, there were some new dental schools that did open over the past few years. You see a trend line here, the number of U.S. dental schools. You see that around, the number here is 56 in 2005, 58 in 2010. So right around 2008, as I showed before, we start to see an uptick in dental schools. They were opening some new dental schools. Now, this is the outflow of graduates estimated by year. These are conservative measurements. The other factor that we need to keep in mind that the ADA researched well is that there was a slowed retirement. The average age of retirement in 2010 was 68. It was 69 in 2018. I think many of us know dentists well into their 70s that are still practicing. And if they're doing it for the love of the game, that's awesome. If they're doing it because they didn't save appropriately for retirement or whatever, then that's, more of an issue. What's interesting is in 2020, we did see that average age of retirement start to dip down a little bit. Well, what happened in 2020, right? I haven't seen great data on this yet, but anecdotally, I think many of us have seen that there were a number of practices that were sold during the pandemic or not long after the shutdown. And so when you look at the increased inflow of dentists and the delayed outflow of dentists, the ADA came to the conclusion, and they were being very conservative, the per capita supply of dentists in the United States is projected to increase through 2040. There's going to be more dentists working more hours of dentistry for the next 20-ish years. The supply is not changing anytime soon. The increase in supply is not changing anytime soon. So this has some different interesting effects on the workforce. This is nice to see. We see age distribution in the workforce. Average age is starting to decrease, in part, of course, because there's more schools opening up and we're that inflow is increasing. Lovely to see. What I will say also, which is lovely, is that there's more diversity entering into our profession. Wonderful. ADA's got great research on this. We love to see this. In particular, I think this has been a big news item that there's more women in dentistry and dental school classes. 50% of female graduates in 2019 were women. That's wonderful. I know in my dental class back in 2005, it was about 50-50 split, which is great. That's wonderful. Terrific. So there's goodness to the increasing number of dental schools, and that dentistry is a very popular profession to go into. If there's a downside to it, well, if you have an increasing supply of dentists, increasing inflow of dentists, delayed retirement of dentists, there's fewer opportunities to enter into an associateship or to acquire a practice. There's more folks trying to find those practices that are up for grabs. And so what we have seen, interestingly, over the past, and these numbers go back almost 15 years, is the percentage of dentists in private practice decreasing. Now, there's another reason here, and that's DSOs. In the background, we have seen an increase in large group practice over the past 15 or so years. When I went to dental school and graduated in 2005, like DSOs were barely a thing, at least in the Northeast, at least here in New York. I never heard of them until a few years later. What's interesting, about 84% of all dentists are in private practice in 2005, and in 2021, that number has decreased to about 73%. So the vast majority of dentists still are in a form of private practice and not in a DSO or in a public healthcare clinic setting. What we do see, though, is very few dentists that are working as solo practitioners. So this is very interesting as we talk about next steps for your journey. Whether you buy or start a practice, are you going to do it by yourself? Would you maybe have a business partner like I did when you start? That's a personal decision, and we'll talk about that in just a couple minutes. But just so you know, on average, over the past, this is the past 20 years, we've gone from about 65% of in 1999, 65% of dentists in private practice being solo, down to about 46%. That's a significant drop. Okay, we've just gone over a whole host of macroeconomic factors. We've hopefully dispelled some myths. One I didn't dispel, but I think it's really important to do. If you're not aware, you're in a good amount of student debt, and I'm happy to say that that's not a factor, not a significant factor in your ability to get a loan to buy or start a practice. I'm sure you're aware there are dental specific lenders. You don't just go into your local bank, local branch of a bank and say, I want to start a dental practice. They're going to have a very different reaction to you than the dental specific lenders, many of whom are, you'll see at a local trade show, American Dental Association meeting, etc. You know these folks. They're super helpful. They are able to give 100% plus financing. So there is this rumor that goes around every now and then, and it's always surprising when I hear from a new dentist that says, "Well, I'm in too much debt to buy or start a practice," and that's just not the case at all. Your debt is a factor. Your student debt is a factor, but it is not the only factor. There are many other things that they will look at before they grant a loan. Okay, so let's talk about business model. I want you to think about your favorite restaurant. I want you to think about the restaurant that, special occasion, you're not afraid to just drop some big bucks on this one. It's going to be fantastic. Picture this restaurant. Picture everything about it. Picture yourself there. You're celebrating a special occasion. It's New Year's Eve. It's a birthday. Taking your significant other out for an anniversary. Okay, you have it in your mind. Okay. Let me ask you, if you were imagining a steakhouse, nice mom and pop, local, high-end steakhouse, compare everything about your favorite steakhouse restaurant to an Outback. If you were thinking of a really nice, high-end Italian restaurant, that's your favorite restaurant, picture it. Compare that, what's in your mind, to an Olive Garden. what are the things that are different about the high-end, beautiful favorite restaurant that you have and the mass appeal? Now, obviously, we're not here in person, so I can't hear you. But typically when we do this exercise in person, I hear things like, well, the quality of the steak is just incredible. And, I'm sure Outback steak is great, but, not as amazing as the Wagyu beef I get at my favorite restaurant. Yeah. Quality of ingredients. Sure. Better wine list. All right. What else? I then typically hear a whole grouping of answers that comes down to what I would call experience, right? It's the ambiance. It's a place to be seen. Everyone's like the host or hostess and the bartender. Everyone's amazing. The chef comes over, does what they call a table touch in the business, and just wows you. The experience. So let's call it the product or service, the quality of the food, and then let's call it experience. Two big buckets. Why you are happy to spend probably a heck of a lot more money at your favorite restaurant than at the, Olive Garden. Okay. Here's what's interesting. Food is arguably commoditized, right? You can get steak anywhere, pretty inexpensively too, I might add. You can get a steak sandwich at Arby's, heck. Why do we spend that extra money for the high-end experience? It's a quality product, sure, but it's the experience. There's room for all of these business models. When Outback first originated, it's not like all the mom and pop steakhouses said, uh-oh, that's it, pack it in, they're going to run us out of business. No. There's plenty of room for Outback Steakhouse and your favorite steakhouse restaurants to survive and to thrive, right? It's because they have different product service offerings and different experiences for different target markets. And there's room for everyone. Now, I would position to you, as I already have said, that dentistry is becoming more commoditized, that our goods and services, our fillings, our cleanings, our clear aligner offerings, that those are becoming more commoditized. And if those are becoming more commoditized, what that means, I believe, is that we should compete more on the experience side. It's real hard to convince someone that just had a crown placed on number 2. They can't even see the darn thing. It's real hard to convince that person that you use the best quality ingredients in the best lab, the materials, that you have so much experience, your hand skills. It's hard to talk about that. We should be proud of the materials and the laboratory partners and the technologies that we use. We absolutely should, and we should talk about that with our patients. But I assure you, as all of those services that we offer become more commoditized, we need to do more than just that. We need to compete on experience, and we need to create a specific experience for target demographics. We need a unique business model. And depending upon your appetite for this sort of exercise, that's going to determine whether or not you're ready for certain next steps, such as ownership. This is a great book, Business Model Generation, written by Osterwalder in 2010. I'm a huge fan of it. It's fantastic. I wrote an article in Dental Economics a few years ago where I go through the material I'm about to go through with you. I'm going to do this very condensed, of course. This is a visual way to create a business model. And whether you are buying a practice that has been around for 50 years and you're acquiring it and now time to make it yours, or whether you're starting from scratch, or whether you've been in practice, you're a new dentist, you actually own your own practice and things are going okay, and you just want to reinvent yourself. You want to take this this great practice to new and exciting levels, I would strongly urge you, unless you're just totally complacent with where you are, I would strongly urge you to take a look at this business model canvas exercise. By the way, is a great exercise to do with your full team. If you are an owner already and you have an office manager or other folks you trust and value their opinion in the practice, heck, do it with the whole team. Go through this exercise so they have some buy-in, they have some ownership of it. We're not going to go through the whole exercise, don't have time for that tonight, but I want to talk about the first two steps, the most important. This is where we take our customers, target demographic, patients, and we give them a unique value proposition, a unique experience. So first, customers, think about for a minute your favorite types of patients. With a broad brushstroke, just get an impression of your favorite types of patients, what they have in common. And so again, if we were a person, I ask folks, give me some examples. And they say things like soccer moms. I'm like, that's a great answer. Yeah, great. Love, that's a great term for caregivers who stay at home, maybe work part-time or aren't working at all. That's a great group to capture. You love treating that type of person. And they of course then bring the whole family, and you just love that type of patient. Wonderful. I've heard people say things like yoga instructors. They just love treating those very in touch with their bodies and minds, spiritual folks. That's just the type of person they love to treat. Great. Come up with a list of 2 or 3 of them. I'll tell you who my group was when I owned a dental practice in Melville, Long Island. It was busy business people. Melville is home to, Henry Schein's U.S. headquarters and many other Canon, Nikon, Estee Lauder, these major U.S. headquarters. And between the hours of 9 and 5, there's tons of what I call busy business people working. I wanted to see them. That was my target demographic. So I asked you next, what is the unique value proposition? What is it that you can offer? In this case, let's say busy business people. I'm not talking about dentistry. That's the stuff that's becoming commoditized, our healthcare service, sad as it is. I'm talking about the experience. How can you present your services to this target demographic differently in a way that rolls out the red carpet for busy business people? What do they want out of their dental appointments? They want lunchtime appointments, evening appointments, early morning appointments, right? They want a very professional, modern looking decor. This is my reception area at Broad Hollow Dentistry. This is what a busy business person would like to see. My other target demographic, by the way, was seniors. I love seeing seniors, one of my favorite groups to treat. Those were my 2, was busy business people and seniors. And so this is what my reception area looked like. What major patient population is not included in that group? Kids. I would see a kid if they came to my practice. Reluctantly. Sure. Yeah, we see kids. I'll take care of them. They're well behaved. Otherwise, I'm referring to my favorite pediatric dentist. But I didn't build my practice for kids. So the busy business person or the senior that walks into my reception area isn't greeted by highlights magazines and broken crayons and stepping over toys everywhere and there's SpongeBob on the TV, right? Just like if you're going to walk into a restaurant and you expect to drop like $150 a plate, when you walk in right next to the bar, there isn't like a ball pit like you're at like Burger King back in the day when they had like the whole kiddie play set. That would be a disconnect, right? For your target demographic. Outback is where you go with the family and have a rootin' tootin' good time. That's their target demographic. Makes sense. We should stop trying to be everything to everyone, and instead, we should start being something very special to target demographics. I'll treat anyone that walks into my office. I will. I'm not turning people away. But I build an experience that caters to people, to certain people. And it affects my office hours, my decor, the service mixture that I provide, so on and so forth. I'm currently the chief dental officer for Tend. This is not a commercial for Tend. I joined that group for many reasons. It was an incredible opportunity to be able to help build a DSO, a large group practice, the way I would want it to be. That takes really good care of patients and also takes really good care of providers. But one of the things that really excited me was they had the same target demographic that I did, busy business people. They treat people in urban, they're only in urban locations. That's it, urban and busy suburban locations. Only startups, they're not acquiring practices, outfitting with technology, and their target demo is urban professionals in their 20s, 30s, 40s, and beyond. That's the majority of their patients. And so, of course, their reception area looks like this, right? This is the future, not Tend, I don't mean that. I mean, the future is not trying to be everything to everyone. I don't think Tend has done a single denture. And I actually love doing dentures, but that's not who we're trying to appeal to. And so I don't care who opens up across from you whenever you have your practice, if you don't already. Doesn't matter. Walmart has dental services now, right? I don't care if they're open next to you. Aspen, Tend, just some other dentist that you know from the dental society. Doesn't matter. Because your practice is going to be special. Because you're going to create a unique experience that caters to certain target demographics. This is how you de-commoditize our products and services. You know, anyone can kind of do a filling. But you're going to do a filling surrounded by an experience that really speaks to your patients, to your target demographics. Let's say you're going to pull off a heist. You're going to steal some money, knock off a bank. You got to assemble a crew. Would you want to be on this team? If you don't know the movie, this is the Big Lebowski. Even if you've never seen it, you kind of get a sense of the kind of crew you're running with here on your caper. Do you want to be on this team? Or when you knock off a casino, do you want to be on this team? Yes. Yes, the Ocean's 11 guys. That's the team I want to be on. This is the difference between a passive and an active business owner. A passive business owner allows the macroeconomic changes to affect and blow them around in the wind. They wait for success to happen to them. An active business owner, on the contrary, doesn't need to have an MBA. No, it just means you ask questions. It means you're thoughtful. It means you lead your practice through an exercise like the business model canvas, and you try to be something special to people, to certain demographics. And so we'll finish up with some career paths. I think I've laid a foundation that will help inform your decisions, because there are going to be decisions that aren't right for everyone. Let's talk about owner or employee. It is absolutely the case today, and it wasn't, say, 15 or 20 years ago, but it is absolutely the case today that there are people that are full-time associate dentists, and that is what they will do for their entire professional career, and they'll be perfectly happy. Owner, employee, and what is if I had to put one, there's so many things that go into this decision, but if I had to put one fine point on it, the pros of being an owner, I know you're aware of them. These are the ones that I think really stick out for me. Your full independence. If this is something you crave, you're just tired of doing it someone else's way, and you bounce around a few associate gigs, you're just like, yeah, I want to do it on my own. Yeah, you're going in the right direction. That independence is wonderful. By the way, the independence can also be a con. There are definitely folks who just don't want to be by themselves, and that's the feeling that ownership could give to them. If this whole exercise we went through about crafting your own business model, if that excites you, yeah, then being an owner might be right for you. In the future, of course, you'll have a practice that you can sell, and that's an asset. There's money that comes from that. What I will tell you is that you need to be saving for retirement and have an exit strategy that includes many other things and not just the sale of your practice. The sale of a solo dental practice can be a significant amount of money, and that's great, but it's not necessarily, retirement money. One of the pros also is you get to do coaching and feedback yourself. Your team is one that you get to coach. You get to lead them through and help develop them. If you're an employee, you may have been frustrated in the past by working with assistants or hygienists or front desk folks, and you don't like some of their behaviors, and you can correct that as an employee. I mean, you might be working in a place that allows you to do that. Well, when you're an owner, it's obviously all yours, and that can be exciting, or it can be a con. It can be intimidating. There is that additional admin time. You are the CEO, so you are in charge of HR and marketing and all of those other decisions. What I will tell you is none of these things are rocket science, especially if you go through an exercise like the business model canvas. There's many other parts we didn't even get to. You go through an exercise like that, a lot of those decisions start to kind of fall into place. Pros of being an employee: obviously way fewer administrative responsibilities, some in many cases none. Your income can be quite predictable. You have a steady paycheck. As an owner, especially one that's starting a new practice, that paycheck may be a little bit more variable. But the cons are ultimately, I would distill it down to just not having control, not having as much control as you would as an owner, that's for sure. And so when do you know if it really is time? I will tell you that I was in practice as an associate about 3 years, bouncing around a few different associate opportunities before I was like, today's the day. Oh my God, I see it. I'm ready to be an owner. And it wasn't because I got an MBA. It wasn't because I figured out how to perfectly run a dental practice. It was because I had opinions on how a dental practice should run. They may even be dumb opinions. They may be wrong. I made a lot of wrong decisions when I became a business owner, but I had opinions. I had thoughts. I craved that independence so I could test things and learn from them if they were dumb, and then move on and get better. So I would distill it down to that question. If you are an associate dentist right now, wondering when to take that next step as an owner, look yourself in the mirror and say, do I really have like definite opinions on how the practices I'm in should run better? If you do, then you might be ready. Should you purchase a practice or do a startup from scratch? The pros of doing a purchase, these are probably self-evident, but let me review them. You're inheriting a bunch of systems and a team and a patient pool. That's great. The con is you're inheriting systems and a team and a patient pool. It's important that your business model, and my goodness, if you're about to buy or start a practice, please go through that business model canvas exercise or something like it. Think about your target demographics. Think about what your dream practice and how that looks and what the different levers are for that. Think about all of that. And if you're going to if you can find a practice that is pretty close to that ideal, maybe you're ready for an acquisition of that practice. But just be aware, if you're going to changing systems, that can take some time, but changing the team is really tough. Really tough. And that's where a lot of the goodwill is stored, in that hygienist, that office manager that's been there for some time. De novo, practice startup from scratch. That's what I did. It's a clean slate. You get to build whatever the heck you want. Of course, that is also the con, is you have to build everything from scratch. But there's ways to do it that are slow and steady. You don't have to have this perfect thing day one. That's impossible. It's not going to happen. It's an evolution. You eat an elephant one bite at a time, as they say. I will say the other cons are, there's a significant cash burn. You can get 100% plus financing from the big dental lenders that are out there. That plus financing is they give you a little nest egg so you can have some cash burn the first couple of months. What you should be doing is spending a good amount of money on marketing just to build up and start practice. This is not a marketing lecture. No time to go into extreme detail there unless it comes up in the Q&A. I would say, can you find an established practice that is close to your ideal? That's the decision point. That's the single question I can distill it down to. Can you find something that's close, not going to be exactly, but it's close. It's got the good bones, as they say, when you're house hunting. Is it pretty close? I recommend working with ADA practice transitions. That's a great group that can help you find a potential practice to purchase. And they go through some really interesting, like matchmaking things to find beyond just what the practice grossed, actually discover some of the personality issues of the team and the doctor you're going to be potentially buying from. So can you find what you want nearby, or your ideal location? It's close to your business model. Can you see how it could be evolved to better fit your business model, the practice of your dreams? And if the answer is no, and you've looked for a certain period of time and you can't take it anymore, then I would say just start it yourself. That's what I did. Solo or small group. I'll touch on this one just briefly. You want a solo practitioner, it's you and only you, or small group, and I'll include partnership in that, a two-person operation. That's what I had. Pros of being solo: it's all yours. You have full control. You get 100% equity of the practice. The cons are that, well, that's a lot of responsibility on just your shoulders. Maybe a lack of there's no camaraderie. You don't have a partner. My goodness, my business partner and I at Broad Hollow Dentistry would bounce ideas off each other all the time. Clinical stuff, just how to handle this tough employee or this tough patient. It was great having that. What I'll say, of course, is if you are solo and you lack that camaraderie, this is the benefits of being in touch with friends from your local dental society, right? I mean, you go to those meetings, get some CE, and you build some great relationships and friendships, and you're able to just have some camaraderie that way and share your woes and also your successes and learn from each other. A small group, whether it's 2, 3, 4, or whatever, partners in the practice, you get that camaraderie. You get shared administrative responsibilities. You get to share the burden. My business partner did all the billing. I hated doing, bouncing the checkbook. Ugh, I didn't want to do that. I love doing system building and HR stuff, and she hated that. So it was great. It was great. Cons: equity split. You're now a 50% owner, or 33 or whatever. So ultimately, when you sell this asset, it's going to be a smaller portion of that. And there's, the partners have to make some decisions, and you may agree, you may not agree. I was very fortunate. My partner and I agreed on all kinds of things. Every now and then we disagreed, and we were super respectful of each other and said, all right, well, you know what, let's try it your way. That makes sense. We were super cool about all that. When do you make the decision? Can you find dentists who share your vision, that share that business model? When I started my journey to do a startup, I knew for me, I needed to have a partner. I really wanted that. I knew I had other things I wanted to do with my time. Could go into that if it comes up in the Q&A, if people have partnership specific questions. But I'll tell you, I have a really, her name's Erin Thomas. Erin and I went to, we work dated, we went to a Starbucks and had coffee and just talked about, tell me your favorite places you've worked as an associate. What did you like? What didn't you like? We started to ask these questions to make sure that we have the same vision for our practice. I've had really good friends and just people that have come up to me and asked questions that have said, hey, I met a guy, they want to start a practice. I don't know, they seem like a total jerk, but I think we can make some money. Should I do it? Should I start this practice with this person? And of course the answer is no. Of course the answer is no. That's like saying, this person's a jerk, but I think I'm going to marry him. I don't know. I think they have some money. Oh, not bad idea. Finally, I will end here. The KOL opportunity, I'm going to touch on this unless there's questions. And if you have questions you don't want to ask here, feel free to reach out to me. I'm always excited to talk about this. This is one of those non-traditional steps. I've been editor of dental economics. I'm now a chief dental officer. I do a lot of lecturing. I love doing that. I've done consulting with different companies. There's all kinds of things that make up a KOL, or what's also known as a key opinion leader, someone that is doing non-clinical things and can even make, a business out of that. It can be a supplement to your income, or it can even take over much of your income. There's lots of ways to do this, and I could go on give a whole lecture just on this. I won't, but my advice in general is, if you want to be an influencer, if you want to do things beyond just clinical dentistry, I would say first and foremost, read voraciously, become an expert on a thing, on business. I became, I think, an expert on business. I don't have an MBA, but I read business books like crazy when I got the dental economics position. Before that, I was lecturing a lot on implants, and I found a nice niche. I lectured on implant complications at a time, it was around 2006 or so. No one was really talking about complications. So I found a niche, and I read a ton of research, and I sat there and took lots of photos of cases, especially cases that didn't go right. And I started creating content, publishing content, self-publishing content on a blog, and writing for other publications, and networking with different implant companies so I could start getting my first gigs. I went to conferences, networked with local sales representatives. It's a hustle, and it can take several years. What I'll say is easier is social media certainly has helped give a quick boost in notoriety for a lot of our folks, sometimes good, sometimes bad. If you have an opinion and you've got a perspective, fortunately, we're able to share that with a wide audience these days, and someone can come to prominence and get on the radar of these companies much earlier. And that's super exciting to be able to do that. So my friends, we very quickly went through the landscape. If you're going to start a practice with partners, start an entrepreneurial empire, hopefully you also found it valuable to talk about the importance of building a business model, because regardless of what steps you take, as long as those steps are intentional, then I think you're going to be greeted with much success. And as long as you're an active business owner, as long as you're not afraid to make some mistakes and learn from them and then quickly move on. It's been a pleasure chatting with you. I am available for questions now. And if you don't want to ask questions, business questions can be a bit intimidating, and I understand that. Here's my my socials and whatnot, and you can find me there and ask. Thank you so much for spending some time with me.
Perfect. Well, Dr. Salierno, you only have one question, actually. And it's actually from, so how are DSOs keeping young dentists who want to become an owner or want to make a salary as an owner?
Good question. So there's different types of ownership. The word owner is not very well regulated from state to state. And so we have an interesting situation where there needs to be a dentist owner on paper in most states. And so they'll typically create, most DSOs will create two legal entities in that dental office. One is a PC and one is an LLC, right? And the PC is the dentist bit, and that's what the dentist owns. And the LLC is the administrative business stuff, and usually the DSO owns that part. So what we are seeing, that's the traditional structure. Now, there are ownership arrangements where it really isn't the same. If you're a DSO owner, you have equity in that local DSO, that practice. Is it the same as if you were, like myself, a business partner and you had 50% equity in a practice? It's different, actually. How different depends upon the contract that you're signing. So please have a dental specific attorney review these things for you. What we have seen is more equity sharing with young dentists as an attractor. Not every DSO does this. Some DSOs are exclusively just, hey, we'll just pay you really darn well as associates. And then there are some that do give a share of equity. You have got to buy into it. There's a lot of guardrails on how that exactly takes place. So really what I would say is the equity piece may be of interest to you, but if just because you have equity doesn't mean you have full control or say in how the operations take place. So please keep that in mind. And just because you have equity doesn't mean there's going to be some big payoff awaiting you when you eventually transition out or retire. Not necessarily. The devil's in the details. So equity ownership is great if you've got control and if you now actually own a thing that has value that you can sell at some point. And depending on how that's structured, it may not be all that you think it is. So buyer beware, caveat emptor.
Well, it looks like we don't have any more questions at this time, unless anybody wants to add one into the Q&A, but I'm going to hand it off to Dr. Wanamaker.
Thank you very much, Grazia, and thank you, Chris. It's always a pleasure to hear you speak. It was a fantastic presentation. A few years ago, you and I were in San Francisco for the ADA meeting, and you were talking about Danny Meyer's book.
Nice.
And I ended up getting that off your recommendation. I've been using that customer service model in my practice, and I can tell you that that made a huge impact on my practice, especially coming back from COVID, shifting into that patient-centered model. So I look forward to trying out that new business model generation book too off your recommendation. And so we have one more new dentist webinar series coming up in our survival guide. You know, as new dentists, we've spent the last, better part of 2 decades working on building our careers to the point where they're at. What would you do if tomorrow you woke up and you were told you can no longer practice dentistry, but you still have all of your bills due the following day? Well, that's exactly what happened 2 years ago when New York State shut down dentistry due to COVID. And we all saw that impact in our lives, in our practices, in our patients. So our next survival guide series is on demystifying advocacy. Our panelists are going to be talking about the legislative process, and you're going to learn how you can get involved yourself to protect your investment that you've put into your career. And we're also excited to have a special guest, State Senator Steve Gennardis, who is going to be talking about why getting involved in government is essential to our future. And that will be on April 27th. So we hope to see you all there. Thank you everyone for participating.